Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and our Chief Medical Officer of Health for Nova Scotia, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Good afternoon, everyone. Today, Dr. Strang will be announcing our 10th death due to COVID, and I want to pass on behalf of all Nova Scotians, our condolences and sympathy to the family and let them know their loss is being felt by all Nova Scotians, and we are here to support you. Dr. Strang.
Thank you, Premier, and good afternoon, everybody. As the Premier said, unfortunately, I have to announce another individual has died of COVID-19. It's an individual as part of a resident of Northwood, part of that Northwood outbreak, and I too want to pass my sympathies and condolences along to the family. It's tragedy upon tragedy these days, but my heart goes to that family. Today we are announcing 16 new cases of COVID-19, which brings the total number of confirmed cases in Nova Scotia to 737. We currently have 11 individuals in hospital, 3 of those in the ICU. We have 286 people now who can be considered to be recovered from their COVID-19 infection, and the total number of Nova Scotians who have been tested and are negative are 22,190. Along with that, we now have 10 licensed long-term care homes and unlicensed seniors facilities that have had cases of COVID-19, and the total number of residents involved amongst these 10 facilities is 128, and the number of staff is 62. Yesterday, I talked about the need for us to mourn and to remember families touched by the events from Sunday virtually. I've had some communication with the funeral service directors who were getting requests from families. I want to clarify that we can't, under the public health rules, funerals or memorial services can happen for immediate family. They can get together in numbers of 5 or less, as well as the rules around social distancing need to be respected. That is being communicated to funeral directors across the province, so they're aware of those rules and can work with immediate families to be able to hold in a limited way some funeral services and memorials. For the rest of us, and for larger extended families, as I said yesterday, unfortunately, we're going to have to ask people to remember and to mourn virtually, and we will find a time collectively when we're able to, due to COVID, to remember the events of Sunday in a way that can bring us more together physically. I also want to touch bases on some questions that have come to me and reminders around access to health care. Even though we have COVID-19 going on, we have significantly ramped down services in our hospitals and shifted many things in primary care to virtual care. We know that Nova Scotians of all ages may need care from the healthcare system for a range of reasons other than COVID. If people, all those services are available. If you have a question about your healthcare and whether you need more immediate care, if you call 911, you will still get to speak to a nurse and go through their process. 811 is available. If you have an emergency, calling 911, you will be assessed and treated as appropriate. If you arrive at an emergency department, you will be treated. We also know that our family physicians and our primary care and our family practice nurses and nurse practitioners are all still available. Many of their services are being offered virtually, but many primary care needs can still be addressed through our existing your existing route into a primary care provider. It just may be that you do it from your home virtually, but please, we want the main message is that if you have other healthcare needs, I'm hearing stories of people about being afraid to go to hospital, feeling that the family doctor's office is closed. There may be a few circumstances the family doctor's office is being closed. closed, but remember, if their office is closed, they may well be available virtually in a different way. So please continue to access health care as you normally would, understanding that there may be some challenges in some areas around increasing waits, but don't let your health care needs just sit unattended to. If you need help, pharmacists are also available for help as well. They're part of the health care team. I want to remind people as well that if you have COVID-related symptoms, that it's important that you access care in the appropriate way. So if you have fever, a new or worsening cough, a headache, sore throat or runny nose, if you have 2 or more of those, you may have COVID. So it's important that you access care by, if you're able to, go to do the 811 online assessment tool and then be directed from there. If you don't have that internet access, then calling 811, and then you'll be directed for testing if appropriate. It's really important that people who have symptoms that could be COVID go through the right way to get care, but we also want to make sure you're getting tested. It's important, a key part of our strategy, as I've said previously, we have 2 components. It's the strong public health measures and then aggressive and easy access to testing. We want to identify every single case of COVID-19 and have appropriate public health follow-up. But if people, for some reason, are not coming forward for testing, we won't know about you. So again, if you have any of those 2 or more of the symptoms that I listed, please contact 811 and go in and get tested. That's a critical part of our strategy as we continue to flatten the curve and minimize the impact of COVID in this province. Premier.
Thank you, Dr. Strang, and now we'll be happy to answer any questions.
Just a reminder that each reporter on the line will have 1 question and 1 follow-up in the time that we have allotted for today. First question will go to CTV's Marie Adset.
Good afternoon. This is a message for Dr. Strang. With COVID already established in Northwood, is it in fact too late to turn back the tide? Once the virus is inside a facility, how do you stamp it out?
So we have established infection control practices that, along with appropriate personal protective equipment for healthcare workers, that we use every year for respiratory viruses such as influenza. We have established appropriate outbreak control measures specific for COVID based on those respiratory virus protocols, knowing that COVID is a respiratory virus, and all those steps that are involved in an outbreak control, which are cohorting individuals, increased environmental cleaning, appropriate personal protective equipment for healthcare workers, stopping activities in long-term within the facility that would potentially bring people together. Those are just some examples. So all those things together can and do have an impact on decreasing the spread of a respiratory virus in a long-term care facility setting. Northwood, we have to understand there has already been widespread of the virus before we even became aware with our first few cases. So there are some challenges unique to Northwood, and given the multiple introduction of the virus, as well as the large size of the facility. But we're in there now. It's exactly part of what the support's coming in from the Nova Scotia Health Authority is, along with the care teams. It's along with people with experience. We have infection control practitioners in there supporting Northwood to make sure that all the steps that can be taken within that facility are being done to minimize the chance of further spread of the virus.
Marie, do you have a follow-up?
I do. Thanks very much. Also for Dr. Strang, I'm looking at how many long-term care homes across the province have cases, residents and staff affected, and with that many staff out, there must be extreme pressure on remaining staff. Are there any plans to offer more personnel support for these facilities, seeing as they seem to be the ground zero?
Absolutely. So from the very beginning, and it started with our first long-term care outbreak, if people remember the Magnolia in Enfield a couple of weeks ago, we have established a process where the facilities will not be left on their own. We have a group that's working, led by people my colleagues in the Department of Health and Wellness, along with continuing care leads from the Nova Scotia Health Authority, the Health Association of Nova Scotia, representatives from the continuing care and the long-term care sectors at that table. And if any facility feels they have staffing challenges, that is brought immediately to that continuing care working group, and solutions are brought to bear. As I've said in previous briefings, I've been very impressed how the whole healthcare system is now working much more collaboratively. And when a long-term care facility runs into challenges that they can't meet on their own, the healthcare system moves in alongside them, whether it's to deal with a Magnolia like we did with staffing, with Northwood, which has staffing and a range of other challenges. Long-term care facilities will not be left alone, and they will be provided the supports as best we can to make sure that essential care continues to be provided to residents.
Next question will go to Alicia Dreas with Global.
Hi, I'm just wondering about, with the 6th death at Northwood, I'm wondering if long-term care facilities have the proper resources to care for some of the more serious cases, and given that they don't have any ventilators on site, would some patients rather be better off at the hospital?
So that's specific to each individual case. We have to understand, I'll talk about Northwood first as part of my answer, that we have actually done, we've brought in resources and people from the acute care sector into Northwood so they can provide the necessary higher levels of care to help as much as possible treat the people who need the higher levels of care in Northwood, keep them within that Northwood environment. As I said yesterday, but we also know that in any long-term care facility, if it's clinically appropriate and it's consistent with the care plan for an individual, that is whether that individual or their family, if the individual themselves can no longer give consent, if the clinical plan and the family wishes align and there's a need for somebody to go to hospital, they will go to hospital. But we have to understand for many circumstances within the long-term care environment, if the goals of the care plan are really more focused on comfort care and quality of life and aligned then with the clinical needs, for many of those individuals, the most appropriate treatment for them is not to send them to the hospital, but to continue to provide the necessary supports and care within their home environment, which is their long-term care environment. But we make no mistake, if people need to go to hospital and it aligns with the wishes of the resident and the family, they will go to hospital.
Alicia, do you have a follow-up?
I do. This one's for the Premier. I just wanted to ask about switching gears to the shooting over the weekend. I'm wondering when the government was informed of what was happening and if EMO was in the loop Saturday night rather than Sunday morning. And do they need to have an explicit request to send out an emergency alert?
So thank you for the question. We were notified that there was structure fires in Portapic around midnight, a little after. Only for information, told that they could not be attended to. We were told potentially this could spread into a forest fire. We were notified then. We were then asked for some later in the morning air support to go provide air support in the air. Our EMO center was activated, has been activated. We brought in staff that had come in, those that especially deal with the alert system. And we need to be the lead agency. In this case, the RCMP has to ask for that alert to go out, because quite frankly, we need the information from them. What is it that they want in that alert to notify to citizens? But we had staff on hand in the morning to be able to do that, but it was not requested.
Next question will go to the Canadian Press's Kevin Bissett.
Good afternoon. A question for the Premier. The other provinces around you are starting to talk about ease-back plans and lifting restrictions in early May. Are you looking at that same kind of timeline for the ease-back from COVID-19, and are you getting any pushback as far as possibly opening the borders?
We'll certainly, as you know, a number of our deadlines are early May. We have to look at schools, daycares, parks, all those. We'll be looking at those in conjunction with public health over the next number of days and into the next week. to see if at all possible, what other measures may be required, or quite frankly, which ones can we work on letting up. But it's too early for that. It's really critical that Nova Scotians stick to the plan of public health. What will determine when the restrictions come off will be us being able to flatten this curve.
Kevin, do you have a follow-up?
I do, and also for the Premier, and this is regarding to the shooting investigation. We're hearing that the military has been sounded out as being possibly assisting Nova Scotia with the investigation. Is there anything to that?
Well, it would be assisting the RCMP, which you know is a federal force. It's not uncommon for federal agencies to provide support. And I heard from Justice Minister and the Attorney General today that the military are part of in providing some assistance to the RCMP in their investigation.
Next question will go to Paul Withers with CBC.
Thanks very much. Today we were reminded again about the challenges that are associated with getting personal protective equipment when the Prime Minister spoke about the cargo plane from Canada and a province that had landed in China and was turned around without loading the cargo. Fortunately, this week in Nova Scotia, we received a large shipment of personal protective equipment, which included 1.7 million masks and gowns and face shields. The health authorities said that it breathed a collective sigh of relief because, in its words, in today's volatile supply chain, we are never able to count a product until it's in our hands. Can you, Premier or Dr. Strang, tell me where this product came from, and what is the status of our supply? Are we in good shape now that we had this big shipment come in?
We had some supply that came in from a couple of different destinations. I know some was China. Not exactly sure of the other ones. As you know, we have put Fred Crooks, Deputy Minister in charge of procurement across the entire government. He's been working with suppliers all around the world and the national government as well, and with some of our own suppliers here. I know Stanfield, an order of stuff has come in from Stanfield's. Some order, part of that order was also a national procurement deal that we had with the federal government, so putting that together. This stock will actually take us into May, and we're very confident that our supply line will be there.
Paul, do you have a follow-up?
Yes, just to tie this off, that plane that was turned around because it was on the tarmac for too long, that wasn't a plane that was chartered in part by Nova Scotia, was it?
Not to my knowledge, no.
Next question will go to Jana Purdon with the Globe and Mail.
Hi, a question for the Premier. Do you know why an emergency alert was not requested by the RCMP, and is that something that you are looking into?
Well, that is something that all Nova Scotians are wondering. What I can tell you, I looked internally on the processes that we had taken place, the contact that we had, and what was requested of us. EMO on their own brought in their alert technicians to make sure that we would be ready to issue an alert. But the reason why the RCMP didn't ask would be a question for them, not for us.
Jana, do you have a follow-up?
I do, yeah. Right now we're seeing these two extraordinary events occurring simultaneously. Even in this press conference, we're going back and forth between the coronavirus and this tragedy on the weekend. Can you talk about any impact that the current situation with the coronavirus is having on the investigation or the aftermath of the shooting events on the weekend?
I don't know about the investigation. That'd be a question better for the RCMP. But I can tell you, for families, this is difficult. This is a horrific event that none of us could have ever imagined would ever happen anywhere, let alone here. And because of the coronavirus, we have to mourn differently. Part of the grieving process is the ability to mourn as a family with friends and community. We have to find a different way to be able to do that. We saw what happened in Newfoundland when funerals were held and someone carrying the virus was attending. It spread through them. So we have to adhere to the advice of public health. But the two happening at the same time is causing, great strain on families and communities, and it's a heavy ask, to be honest with you, to ask these families who have been hit with such a devastating trauma to now work with public health to ensure that the virus doesn't spread, and ask them to work with us to find a unique way to mourn their loved one.
Next question will go to Brian Flynn with All Nova Scotia.
Hi, Premier. According to a timeline the Auditor General released, I believe it was in December, the province was supposed to identify a preferred bidder for the Bears Lake Outpatient Centre in March. If that did happen, could you tell us who was chosen? And if it didn't, could you tell us what the new timeline looks like?
I don't have that information with me now. I know that I don't believe the bidder's been chosen, but I can get that information for you.
Brian, do you have a follow-up?
I do, thanks. And Premier, do you expect the construction and completion of both the outpatient center and the Halifax Infirmary expansion will be delayed because of the pandemic? And if so, do you have any idea of how long the delay would be?
So our biggest challenge really is when construction is working inside of facilities. The two that you described, by and large, are external projects. So the one in, for example, in Bears Lake is a standalone project. So once that is issued, we expect that to meet the timeline. The same thing with the external stuff that's happening at the QE2. The parking garage has been dealt with, so we can see some of that project move forward. Where we are seeing some challenge on all of our infrastructure on healthcare is stuff that is currently happening inside of a physical facility. So some of those may be delayed based on COVID.
Next question will go to John McPhee with the Chronicle Herald.
Thank you. This is a question for Dr. Strang. Care providers tell me that they get 2 N95 masks each day, but they worry that these masks can become contaminated quickly. Can you reassure them that 2 masks a day is sufficient?
So, first of all, it's 2 surgical masks, not 2 N95 masks. N95 masks are reserved for a specific purpose. I think it's always across the country, everybody's managing the requirement for masks for frontline healthcare providers, but doing it in the way that meets our supply. I think in general, my understanding, staff have been given those 2 masks, but if there are specific circumstances where a mask becomes soiled or no longer effective in some other way, that I do not believe that they're going to be provided a replacement mask.
John, do you have a follow-up?
Yes, I do, and this is again for Dr. Strang. Can you give us an update on the general situation at Northwood today, besides the sad news of the death, of course? There's been no information on any new cases or generally what the situation is there today. Can you provide any information on that?
So we do know that we've had, unfortunately, another death at Northwood. Of the 16 cases that we overall, one of those is another positive resident at Northwood. That may seem low compared to what we've had over the last few days. The reality is that the test results that we would be talking about today would have come in through the lab yesterday, and they would have been generated over the weekend. And we know that because of all the transition that was happening on Saturday, there was very little testing happening on Saturday at Northwood. So I knew that, and I fully expected today we wouldn't have a lot of results. Enhanced testing started on Sunday, so I fully expect that over the next few days we'll see the results of that enhanced testing, and fully expect to see the numbers of positives coming from Northwood to go back up again. In general, my understanding is that things are going well. We've had, I believe, another 2 people transferred, recovered, and been able to transfer to the hotel environment. That the supports from NSHA are working well and getting in place, and as also the enhanced testing strategy in place. So all the things we looked for that were put in place on the weekend are moving forward as they should.
Next question will go to Paul Legier with Radio Canada.
Yes,
This question is for my colleagues working on the mass shooting, and it's for the Premier. Premier, following the mass shooting, should Nova Scotians still feel safe at home, and why?
As been described, it was a lone assailant that we now know is deceased. Nova Scotians should feel safe at home. They should continue to check in on neighbors, support one another. The threat of what we saw on the weekend has been distinguished, but the reality of it is the trauma of it will still be with us for a long period of time, particularly in those communities, and particularly for family and friends and the network associated with people, the victims of this crime. And it's my hope that Nova Scotians, Canadians, and really our friends around the world continue to check in on each other to make sure that we begin the healing process.
Paul, do you have a follow-up?
Yes, what kind of precautions could the province take to protect its citizens against this kind of threat that we observed during the weekend?
Well, we continue to have law enforcement agencies who work on behalf of both federal government and provincial governments and municipal law forces. But what we need to continue to do is look out for one another. This was an unthinkable act of sheer violence against our province and against a particular part of our province. And we need to do everything we can as a province to not let that act of violence define us or define our way of life. It will be with us. It'll change us in ways. But it cannot be what defines us. What defines us will be how we react and come out of this. Nova Scotians have been embracing this Colchester County and parts of Cumberland and beyond with love and kindness and support that we're known for, and the community-minded focus that we're known for. And if I had a message for Nova Scotians, it is to not to let the individual define us, but let the spirits of the victims define us. They were community-minded people who cared and loved for each other and supported one another, and were building a life for themselves and the community, making a difference in this province. That's what we should be working towards to let define this tragedy that has been brought to us.
Next question will go to Katie Hartai with News 95.7.
Thank you. The QE2 completed 516 tests yesterday. We know it's able to process more than double that. Dr. Strang, you just mentioned that this is because of the weekend's tragedy. Do you expect that we'll see the number of tests being processed reach its capacity again?
So I think there's a number of factors that potentially could lead into that lower number than we have seen in the last couple of weeks. One was certainly a decreased testing in Northwood on Saturday. We know that the events on Sunday, people getting tested for COVID, was not on their mind, and I'm sure that's had an impact on that would have resulted in far fewer tests being done, and therefore going to the lab to be run through on Monday. We're also we are coming to the end of our flu season, so we have less people that may get the symptoms that that are on our list, fever and cough, that we're asking them, if they get those, to go ahead and to go get tested. So there's a number of things that are at play, some longer term, some shorter term. That's one of the reasons I said earlier today, it's critically important that any Nova Scotian with those list of symptoms, fever, 2 or more of fever, new or worsening cough, sore throat, headache, runny nose, make arrangements, contact 811, get in and get tested. We don't want to miss a case of COVID, and we have lots of access to testing. There's no wait time at all really for 811. Our assessment centers are open. We have mobile and flexible capacities if we need them in various communities. There's no lack of access to testing. I just want to remind Nova Scotians that if they got symptoms that could be COVID, we need you to get tested. We'll see over the next few days how some of these short-term factors over the weekend, whether if they play out, and also what the impact of as we're moving out of flu season may be longer term. But we have lots of capacity to be tested. We want everybody to be tested. It's a key part of our strategy.
Katie, do you have a follow-up?
Yes, please. Premier McNeil, for weeks now, the Funeral Service Association of Nova Scotia has been calling on government to designate funeral providers as an essential service. I'm just wondering if, after what happened on Sunday, if there's any talk in government about making that happen.
Do you want to?
Yeah, so I've been in communication with the funeral service sector, recognizing that we haven't identified any specific business or sector as essential as part of the pandemic response. If necessary, we would do that, and funeral services are on that list. But we haven't actually specifically gone to an essential services list for anybody. But I've been in communication with them. I'm going to be communicating with them later this afternoon, reminding them about the importance of their work, that they've had questions for me about how they continue to handle bodies and remains in a safe way in an environment of potential COVID, reminding them of those ways, and also reminding them of the rules around that I talked about earlier around very small numbers of people, 5 or less, with social distancing that are allowed if they are going to hold funerals and memorial services.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, thank you. Dr. Strang, there has been confirmed a case of COVID-19 with a prisoner at the Burnside jail. I'm told that that prisoner was never in with the rest of the general jail population. But prisoners tell us that previous to that person being tested positive, jail staff was moving back and forth between that medical unit and the general population. Are you concerned that there may be a COVID outbreak in the jail in coming weeks?
That's something where we have worked. We have robust plans in place. For a number of weeks now, there's been a team led by the Nova Scotia Health Authority, Dr. Lisa Barrett, an infectious disease expert, as well as infection control, and other folks through their offender health services, working with Department of Justice, Correctional Services, ensuring we have appropriate steps in place in our correctional system to minimize the chance of the introduction of COVID-19, have plans in place to, in case somebody does come in, and how do we would respond to an outbreak. The fact that this individual was isolated from the very beginning is due in part to the protocols that were put in place related to COVID-19. So we've done everything we can. One of the key pieces of preventing or minimizing the chance of an outbreak in the correctional facilities is reducing the number of offenders that are in a facility, and the corrections has worked very collaboratively with our court system, and we have, my understanding, what I've been told is we've decreased by about half, or even less, more than half, the number of offenders right now in our correctional facilities, which has allowed greater spacing between offenders and decreasing the risk of transmission. So I've reviewed those plans. I've had conversations with Dr. Barrett and the correction services. I think we have a very robust and appropriate steps in place related to COVID-19 in our correctional facilities.
Tim, do you have a follow-up?
Yeah, I do. Again, for Dr. Strang. Looking at Nova Scotia's numbers across the board, they're positive. We have relatively low rates of people testing positive, while we have high rates of testing. And that's a good thing, certainly. But I wonder if you could also look at it a different way, is that the vast majority of people in Nova Scotia have not been infected, have not built up any immunity because they have not been infected. And I don't know how we ramp down the restrictions, bringing in people traveling from other places and so forth, if so many people are as vulnerable to the disease as before this started. Do you have any insight into that?
So that's exactly a part of the conversations that I'm involved in, my team is involved in nationally. How do we actually loosen things up, knowing we have a large proportion of the population that may still be vulnerable, that haven't developed immunity. And that's why internationally the conversation is about doing things very slowly and carefully, and that we may well see multiple waves, that as you necessarily loosen things off carefully, you may get some reintroduction of the virus, and then you may have to tighten things up again. This is all based on paying close attention in the coming weeks and months, having good, robust surveillance systems, and monitoring the disease activity carefully, and having the ability then to adjust both the health system response and across government response. And in Nova Scotia, I think we've shown that we have that strong ability of a single health authority working with the department. We have a very solid single health system approach, and certainly my ability to work closely with the Premier and through him the rest of government, a very strong cross-government approach. So we will move forward based on our epidemiology and deal with this. But it's not a single wave that we get through. We have to be prepared, as I've been saying, as public health folks across the world have been saying. This is quite likely the next 12 to 18 months as we deal with this till we finally get a high enough level of immunity in our population that COVID no longer becomes an area of major concern.
That's all the time that we have for questions today. Go ahead, Premier.
Thank you very much, Chrissy. In the midst of families coping with COVID-19, our province is also reeling from the horrific events of the last number of days. We've experienced so much death, and it's hard to comprehend. We have heard from so many people in our province, across the country, and indeed beyond. I want to say thank you on behalf of all Nova Scotians for reaching out. Many of you have posted photos of our famous Nova Scotia tartan. You see it on the screen behind me, wrapped around a heart, symbol of love and support. It doesn't take away the pain that families are experiencing, but it is our way of coming together without coming together. Many of you have opened your hearts online and shared your memories. You are honoring those we lost in a beautiful way. We have set up a book of condolences online at novascotia.ca/condolences. I have signed the book today, and I encourage all of you to do the same. It's another opportunity for people anywhere in the world. They can come together to express their feelings and messages to the families. We all need to come together, to pause and let ourselves feel. This isn't easy in the midst of COVID. So wherever you are right now, please join me with Dr. Strang and observe one moment of silence in memory of those that we have lost.